121. The nurse should prioritize a patient with a sudden drop in blood pressure over a patient awaiting a routine lab draw. True or false? Answer: true. Rationale: a sudden drop in blood pressure may indicate shock, requiring immediate intervention over routine labs, per ANA prioritization principles. 122. A nurse can delegate the administration of an 4 antibiotic to a UAP. True or false? Answer: false. Rationale: 4 antibiotic administration requires clinical judgment and is outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 123. The nurse should ensure a patient's medical record is secure to maintain confidentiality. True or false? Answer: true. Rationale: securing medical records protects patient confidentiality and complies with HIPAA regulations, per the Joint Commission standards. 124. A nurse can ignore a patient's complaint about pain due to a busy schedule. True or false? Answer: false. Rationale: pain complaints must be addressed promptly as part of patient-centered care, per ANA ethical standards. 125. The nurse should include the case manager in planning care for a patient with complex social needs. True or false? Answer: true. Rationale: case managers address complex social needs, ensuring holistic care and discharge planning, per the Joint Commission interdisciplinary standards. 126. A UAP can perform a neurological assessment on a patient. True or false? Answer: false. Rationale: neurological assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 127. The nurse should report a coworker's medication error to the supervisor. True or false? Answer: true. Rationale: reporting medication errors promotes patient safety and supports quality improvement, per the Joint Commission safety standards. 128. A nurse can delegate the administration of a nebulizer treatment to an LPN. True or false? Answer: true. Rationale: LPNs can administer nebulizer treatments under RN supervision, per NCLEX-PN scope of practice guidelines. 129. The nurse should prioritize a patient with a new onset of chest pain over a patient with a scheduled dressing change. True or false? Answer: true. Rationale: new onset chest pain may indicate a cardiac emergency, requiring immediate assessment over routine tasks, per ANA prioritization principles. 130. A nurse can share patient information with a family member without verifying their identity. True or false? Answer: false. Rationale: verifying a family member's identity ensures compliance with HIPAA and protects patient confidentiality, per federal privacy regulations. 131. The nurse should ensure a patient's bedside rails are up for those at risk for falls. True or false? Answer: true. Rationale: raising bedside rails for high-risk patients prevents falls, promoting safety, per the Joint Commission safety standards. 132. A UAP can assist with performing a sterile wound irrigation. True or false? Answer: false. Rationale: sterile wound irrigation requires sterile technique and is outside the UAP scope, reserved for licensed nurses, per NCLEX-PN delegation guidelines. 133. The nurse should advocate for a patient's right to a second opinion. True or false? Answer: true. Rationale: advocating for a second opinion respects patient autonomy and promotes informed decision-making, per ANA ethical standards. 134. A nurse can delegate the evaluation of a patient's response to a new treatment to a UAP. True or false? Answer: false. Rationale: evaluating treatment responses requires clinical judgment and is within the RN scope, not the UAP's, per NCLEX-PN delegation guidelines. 135. The nurse should include the chaplain in the care plan for a patient requesting spiritual support. True or false? Answer: true. Rationale: chaplains provide spiritual support, addressing holistic patient needs, per the Joint Commission patient-centered care standards. 136. A nurse can administer a medication without a second nurse's verification for high-risk drugs. True or false? Answer: false. Rationale: high-risk medications require double-checking by a second nurse to prevent errors, per the Joint Commission safety standards. 137. the nurse should report a patient's fall risk to the interdisciplinary team. True or false? Answer: true. Rationale: reporting fall risks ensures the team can implement preventive measures, promoting safety per the Joint Commission standards. 138. A UAP can assist with feeding a patient with no swallowing difficulties. True or false? Answer: true. Rationale: feeding patients without swallowing difficulties is within the UAP's scope if trained, with a nurse ensuring safety per NCLEX-PN delegation guidelines. 139. The nurse should prioritize a patient with a new arrhythmia over a patient awaiting discharge instructions. True or false? Answer: true. Rationale: a new arrhythmia is potentially life-threatening, requiring immediate assessment over routine discharge teaching per ANA prioritization principles. 140. A nurse can delegate the administration of a PRN medication to an LPN. True or false? Answer: true. Rationale: LPNs can administer PRN medications under RN supervision per NCLEX-PN scope of practice guidelines. 141. The nurse should ensure a patient's informed consent is documented before a procedure. True or false? Answer: true. Rationale: documenting informed consent ensures legal and ethical compliance per the Joint Commission standards. 142. A UAP can perform a 12-lead ECG interpretation. True or false? Answer: false. Rationale: ECG interpretation requires clinical judgment and is outside the UAP's scope, reserved for licensed professionals per NCLEX-PN delegation guidelines. 143. The nurse should report a patient's adverse event to the quality improvement team. True or false? Answer: true. Rationale: reporting adverse events supports quality improvement and prevents future incidents per the Joint Commission safety protocols. 144. A nurse can ignore a patient's request for pain medication due to staffing shortages. True or false? Answer: false. Rationale: pain management is a patient right, and nurses must address it despite staffing challenges per ANA ethical standards. 145. The nurse should include the home health nurse in the discharge plan for a patient requiring ongoing care. True or false? Answer: true. Rationale: home health nurses ensure continuity of care post-discharge, addressing ongoing needs per the Joint Commission standards. 146. A UAP can assist with performing a sterile urinary catheter insertion. True or false? Answer: false. Rationale: sterile catheter insertion requires sterile technique and is outside the UAP's scope, reserved for licensed nurses per NCLEX-PN delegation guidelines. 147. The nurse should prioritize a patient with a blood glucose of 45 milligrams per deciliter over a patient with a scheduled physical therapy session. True or false? Answer: true. Rationale: hypoglycemia, 45 milligrams per deciliter, is a medical emergency requiring immediate intervention over routine therapy per ANA prioritization principles. 148. A nurse can delegate the administration of an intramuscular injection to a UAP. True or false? Answer: false. Rationale: intramuscular injections require clinical judgment and are outside the UAP's scope, reserved for licensed nurses per NCLEX-PN delegation guidelines. 149. The nurse should ensure a patient's room has adequate lighting to prevent falls. True or false? Answer: true. Rationale: adequate lighting reduces fall risks, promoting patient safety per the Joint Commission safety standards. 150. A nurse can share patient information with a volunteer without consent. True or false? Answer: false. Rationale: sharing patient information with volunteers violates HIPAA unless authorized by the patient per federal privacy regulations. 151. The nurse should include the physical therapist in the care plan for a patient with a recent hip replacement. True or false? Answer: true. Rationale: physical therapists provide expertise and mobility, ensuring comprehensive care post-hip replacement per the Joint Commission standards. 152. A UAP can perform a patient's initial pain assessment. True or false? Answer: false. Rationale: initial pain assessments require clinical judgment and are within the RN scope, not the UAP's, per NCLEX-PN scope of practice guidelines. 153. The nurse should report a patient's medication allergy to the pharmacy. True or false? Answer: true. Rationale: reporting medication allergies to the pharmacy prevents adverse reactions, ensuring safety per the Joint Commission standards. 154. A nurse can delegate the administration of a tube feeding to an LPN. True or false? Answer: true. Rationale: LPNs can administer tube feedings under RN supervision per NCLEX-PN scope of practice guidelines. 155. The nurse should prioritize a patient with a pulse oximetry reading of 85% over a patient with a scheduled lab draw. True or false? Answer: true. Rationale: a pulse oximetry reading of 85% indicates severe hypoxemia, requiring immediate intervention over routine labs per ANA prioritization principles. 156. A nurse can administer a medication without verifying the dose. True or false? Answer: false. Rationale: verifying the dose is part of the 5 rights of medication administration, preventing errors per the Joint Commission safety standards. 157. The nurse should ensure a patient's call light is answered promptly to promote safety. True or false? Answer: true. Rationale: promptly answering call lights prevents patient injuries and promotes safety per the Joint Commission standards. 158. A UAP can assist with performing a sterile dressing change. True or false? Answer: false. Rationale: sterile dressing changes require sterile technique and are outside the UAP scope, reserved for licensed nurses per NCLEX-PN delegation guidelines. 159. The nurse should advocate for a patient's right to refuse a procedure. True or false? Answer: true. Rationale: advocating for a patient's right to refuse a procedure respects autonomy, provided they are informed per ANA ethical standards. 160. A nurse can delegate the evaluation of a patient's nutritional status to a UAP. True or false? Answer: false. Rationale: evaluating nutritional status requires clinical judgment and is within the RN scope, not the UAP's, per NCLEX-PN delegation guidelines.